Good afternoon and good morning, everybody. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be reviewing our phlebotomy questions. That is right. So if you are anticipating taking your phlebotomy certification examination, you're in the right place. And so we'll give you a few moments to receive your notifications and we will get started shortly. Welcome to the Phlebotomy Practice Test brought to you by Florida Training Academy and, of course, your favorite nurse educator, Nurse Eunice. This video is designed to help you boost your knowledge and boost your confidence before taking your national certification exam or beginning clinical practice. You'll review essential topics like infection control, proper collection techniques, order of draw, blood culture procedures, and common safety protocols. Whether you're a student, a recent graduate, or just refreshing your skills, this practice test will help you identify areas that you need improvement so you can walk into your exam or job prepared and confident. And good morning, everybody. If you need additional resources, we do have them. Of course, we have our YouTube channel. And yes, we actually have videos of us doing phlebotomy and also IVs. So if you need additional practice, first place would be our YouTube channel. And then, of course, our website. If you're in Jacksonville, Florida, you can register for a course here in person. And then we also have free study guides, and you can get those at nurseeunice.com. If you've not yet taken a phlebotomy certification course and you're interested in doing so, we've partnered with CareerStep. And with CareerStep, they actually have hybrid courses. What does that mean? You can take a portion of your course online, and then whenever it's time for you to do your externship, your clinical hours, they're going to work with you nationwide to find a clinical site in your area so you can get your hands-on skills. And so if you're interested in a phlebotomy tech program that works with your schedule, you would go to floridacareeracademy.com, or you can call one of the CareerStep advisors at 877-225-7151. And that is how I would recommend that you get started in a phlebotomy tech role without spending a lot of money or having to go to a college campus every day. And before we get started, if you've not yet liked, shared, or subscribed to our channel, go ahead and do so. We are so close, you all. Today, we should have 950,000 subscribers. And I know that's just a vanity number, but that just shows me how much you all love me, how much you all support our business and our channel. And so if you've not yet subscribed and you're just here watching our videos and learning, go ahead and make it official, because we want to have 1 million subscribers this summer. And we know we can do it with your support. All right. And then Raven, I'm so proud of you, Raven. Raven says that she passed their PCT examination last Friday. Congratulations. All right, let's get started, team. All right, so you're ready for this test. What we want you to do is to find a quiet space to focus. You can have a notebook or scratch paper readily available. Read each question carefully and then trust your instincts. You already have a heart for patient care and you're a safe provider, so you more than likely know the answer. Don't second guess yourself. Question number 1. A phlebotomist must collect blood cultures on a patient with a central line and signs of sepsis. What is the most appropriate action? A, draw from the central line only. B, clean skin with alcohol and collect both sets from the same arm. C, use iodine and collect both samples through the IV line. Or D, ask the nurse to collect the specimen from the central line. We'll give you a few moments. Let's see if you know your scope of practice as a phlebotomist. What do you do? And we'll reveal the answer in 5, 4, 3, 2, and yes, if you chose D, that is absolutely correct. Phlebotomists do not draw from central lines or IV lines. They perform venipuncture. So phlebotomists are typically not permitted to access central lines due to the risk of introducing infection and because it requires specialized training and sterile technique. Drawing blood cultures from a central line is often a nursing responsibility or requires advanced credentials. Instead, the phlebotomist should collect the peripheral blood cultures, which means you perform venipuncture using proper aseptic technique if if peripheral draws are requested. So that would be something you would escalate to the nurse, and the nurse will contact the doctor if needed. But you do not draw from a central line. Question 2. A fasting glucose test is ordered for 9 a.m. The patient accidentally eats toast at 7:45 a.m. What should the phlebotomist do? A, proceed with the draw and note it on the requisition. B, cancel the order entirely. C, reschedule the test and inform the nurse or the physician. Or D, ask the patient to fast again for 2 hours. All right, I see some correct responses coming through. Let's see if we can get a few more. Revealing the correct response in 3, 2, and yes, you all have it. Great job, team. The correct response is C. Eating invalidates a fasting glucose test. The provider must be notified so they can reschedule or revise the test. So that was perfect. We don't want to go ahead and perform the test because it could be elevated because the patient wasn't fasting as requested. Question 3. A tourniquet is left on for 2 minutes during difficult venipuncture. Which of the following may be affected? Is it A, hemoglobin, B, potassium, C, sodium, or D, platelet count? And this one is a little more tricky, so I want you to have those pens and papers available so that you can write your notes. We'll start looking at the answers shortly. I see an A that has come through. Let's see if we have any other options. Oh, Jennifer, you are so welcome. Jennifer says that she took her CNA exam on last week and she passed, and I will make sure that I pass that on to my team, Jennifer. We appreciate you so much and best of luck with your CNA and nursing career. All right, everybody. So let's see what the answer is. You left the tourniquet on for too long. What lab is going to be affected? And if you said B, you are correct. It wouldn't be the hemoglobin. It would be the hemo concentration. It could falsely elevate the potassium level. And so that's why you do not want to keep a tourniquet on for too long. You can usually keep it on for 60 seconds up to a minute. And if you've not completed your venipuncture, you would have to release the tourniquet and then reapply. Question number 4. Which of the following specimens must be protected from light after collection? Is it bilirubin, blood cultures, ammonia, or troponin? Miss Benita, I see you changed your answer. All right, so what do you think, team? Which specimen must be protected from light? And it's so interesting. We get a lot of requests for phlebotomy videos, and I didn't know how much interest you all had in phlebotomy. But in some of our areas, our PCTs or CNAs who work in the hospital, our patient care techs, they actually draw blood in the hospital. And then, of course, if you're a nurse, you got to know how to draw blood. So it makes sense that you all are requesting a phlebotomy video. So if you can share this video with a friend, a fellow student, we'd appreciate it. And so the specimen that must be protected from light, everybody, think about the babies when they have the tents and the hoods because they have elevated bilirubin levels. So it's going to be A. Bilirubin breaks down in light. Specimens must be wrapped in foil or placed in amber tubes. So I hope you learned something new there. Question number 5. A phlebotomist draws a CBC, PT/INR, and a basic metabolic panel. We refer to that as a BMP. What is the correct order of draw? Oh, what is it? Are you going to draw a red top first, followed by a blue and a lavender? Or will it be a blue top, followed by red, green, and lavender? And if you need more information about the order of draw, whenever you go to our website, just give me a day because I have to upload the phlebotomy study guide. It will have the order of draw in it, so it will help you out. But I want you to notice you only have 3 specimens to collect. So you don't need 4 tubes. That's a hint. And so when you think of the order of draw, what color tube comes first? And yes, Melissa, we're going to make sure you get more videos. All right. And I have a lot of people choosing A. I had someone who chose B. You have 3 labs. A PT and INR go together. So they're collected in the same tube. All right. Revealing the correct response in 3, 2, and this one's hard. Let's see if you got it. And then Augusta and Miss Bonita, you both chose D, so you have it. The correct order is going to be blue, that is for your coagulation studies like PT and INR, followed by green, which is for your basic metabolic panel or BMP, followed by lavender, which is for your CBCs, your complete blood count. Red is for serum, and so that 4th tube was not needed for the lab test that you had there. And then Gigi, thank you so much for your nice comment. Gigi said, let's read it here. I can't thank you enough. I love your videos and help me so much. I'm going to pass my phlebotomy test. And yes, we're going to speak it into existence. You're going to do well. All right, question. Oh, here's our little mnemonic here. And so I'm going to hide my face so that you all can see it better. You can take a picture of it, or you can always come back later. I'm going to also include these slides whenever you do download your workbook, which is free, your ebook. So the slides from this particular practice test will be included, but the order of draw, and this doesn't include every tube color, but here's just the beginning. It's going to be yellow, which is usually your blood cultures. Blood cultures first, followed by blue for your coagulation studies, then red, then green, then lavender and gray. And so again, this is in every tube, but these are the most common tube colors. And the way to remember this is by saying your for yellow, brother for blue, Robert for red, gives for green, lovely for lavender, gray for gifts. Your brother Robert gives gray. Your brother Robert gives lovely gifts. And so that's a mnemonic. That'll be a way for you to remember the first letter. You can write that down. You can practice it. And that will be the basics of you understanding the order of draw, so that when you draw your labs, you don't contaminate your specimens. All right, you all, let's go to our next question. Question number 6. A finger stick is performed and the first drop of blood is wiped away. Why is this done? To reduce the chance of infection, to reduce clotting, to remove interstitial fluid contamination, or bilirubin levels. Why do we wipe away the first drop of blood whenever we're doing a capillary, whenever we're doing a finger stick? You have to check someone's blood sugar. All right, why can't you leave that first drop of blood there? Hey, Barad, I haven't seen you in forever. Hey. All right, revealing the answer in 3, 2, and let's see if you got it. All right, so if you chose C, you are right, because the first drop contains tissue fluid, interstitial fluid, and that fluid can dilute the sample. Wiping it away ensures more accurate results. So whenever you're doing a finger stick, you usually wipe away the first drop of blood. Question number 7. Which of the following lab tests requires the patient to remain in the lab for several hours? Is it going to be a hemoglobin A1C, a glucose tolerance test, a random glucose level, or a PT-INR? I know you got it. I know you can get it. Come on, think it through. Think it through. Why would a patient need to be in your lab for hours? Revealing the correct response in 3, 2, and I think Melissa had it. The correct response is, let me make sure I have it right there. Yeah, it's going to be B, your glucose tolerance test. And so usually a GTT is done to determine whether or not a pregnant mother has gestational diabetes. And so they have to drink a substance, they get their labs checked. They drink another substance, they get their labs checked. So they can be there for about 4 hours. So a GTT or glucose tolerance test requires timed specimens at intervals post glucose ingestion. The patient must remain under observation. And so that is something new that a lot of you all learned. So make sure you write that down. GTT, time test, glucose tolerance test for gestational diabetes. You'll be performing those on pregnant mothers. All right, our next question, team. And I do apologize. My system's going really slow today. What should a phlebotomist do if a requisition, which is a lab order, lacks the physician's name? Is it A, call the lab to clarify before proceeding? B, fill in a physician's name from memory? C, refuse to draw the blood? Or D, continue the draw but leave the physician field blank? Stephanie, good luck on your test. All right, we'll give you a few seconds for this one. We'll reveal the correct response in 5. All right, and so here's your response, team. Yes, everybody had it. It is A. A missing physician's name is a compliance issue. Confirm with the lab before proceeding to ensure test validity. And good morning, Marie. Thank you for the kind remark. All right, question 9. Which of the following is the most appropriate site for heel sticks in infants? Would it be the lateral or medial plantar surface, the center of the heel, the big toe, or the arch of the foot? All right. You're working at a children's hospital. There's an infant who's in your, we'll say they're in your ER area, and you're the tech down there today. You're the phlebotomist. Where are you going to stick this infant? And I see a correct response. So revealing the answer in 3, 2, and yes, a lot of you all got it right. The correct response is, and my screen is going really slow, so I do apologize if there's a delay on your end also, but the correct response is A. The lateral or medial plantar surface avoids bone injury. You never want to stick in the center of an infant's foot or the arch. And so when you see the sides that don't have lines, those lateral sides, that's where you would do your stick on an infant. All right, let's go to the next one. And thank you all for studying with me on a Friday morning. You all make me feel so special. All right, question 10. A lavender tube is underfilled. You didn't put enough blood in it. Maybe the patient was dry that day. That's what we call them when they're dehydrated. And so which test result is most likely to be affected by having an underfilled tube? Is it going to be sodium, creatinine, hematocrit, or glucose? And then Geraldine, she gave another mnemonic. It says, a young blonde rainbow girl loves gold. And so you all can also get, and I'll make sure I include a supply list with our ebooks, but you all can also get like little attachments that you add to your badge that will have the color, the order of draw. And so you don't have to initially remember all this. Give yourself grace, give yourself time. It's going to come together. You just got to practice a lot, and you have to have little reminders like what you put on your badge, or you have to remember the mnemonic. And so for question number 10, if a lavender tube is underfilled, remember what lab is collected in a lavender tube. We kind of covered it in a previous question. And so for question number 10, the answer is yep, you got it. It is C. And so we have an image over here of an improperly filled tube. A lavender tube is for CBCs. And so Over time, you're going to learn what labs are collected, or whenever you take a CBC, what labs are included within that panel. And so underfilling a lavender top tube can lead to inadequate anticoagulant. So it has a preservative, it has EDTA inside of it. It can also lead to sample dilution and errors in hematocrit measurements. These issues can result in inaccurate test results, potentially leading to misdiagnosis and improper treatment. And so if you ever have a tube that is underfilled, you are to discard it, or if the patient is just a hard stick, you're not able to get enough blood, you can always ask if you can use a pediatric tube instead. So that way your EDTA to blood ratio would be maintained. Question 11. And for you all, I again want to apologize because my screen is going so slow. I don't know what is happening. All right, so let's see if we can get question number 11 on the screen for you all. Thank you for your patience. I like to say there's an alien overhead whenever it starts moving this slow. And so Salam wants to know, what is the requirement for the course and what are the days of lecture? And so with our partnership with Career Step, you get to choose your own schedule. And so you would be able to watch and complete your modules at your own pace. And then they would work with you to find a center, a doctor's office, a blood bank for you to get your sticks at in your area. The only issue is that you have to be within the United States. Otherwise, they cannot obtain those clinical partnerships. And so you always can go to FloridaCareerAcademy.com to get more information about our hybrid phlebotomy courses. All right, so question 11. While drawing blood, a phlebotomist notices a hematoma is forming. What should they do first? A, apply pressure and continue the draw. B, stop the draw immediately and remove the needle. C, finish filling the tube before applying pressure. Or D, elevate the arm and start over. And so a hematoma is a collection of blood beneath the skin. The blood is escaping the vein and it's filling a surrounding tissue area. What do you do when a hematoma is forming while you are actually providing or trying to get a blood specimen? All right, and so I see some answers coming through. And if you chose B, you are correct. And again, this system is moving really, really slow, so bear with me. I'm going to lay hands and pray over this system so it moves faster. All right, there we go. A hematoma indicates bleeding under the skin. The procedure must be stopped to prevent further damage. And so is it Laficia? You're correct. Rabina, you're correct. And of course, Augusta, Miss Bonita, and 70, you're correct also. Question 12. Which of the following scenarios presents the greatest risk for think about the prefixes, pre-analytical error? Is it going to be A, patient identification is required with ID and verbal confirmation? B, tubes are inverted gently after collection? C, specimen for lactic acid is placed on ice? Or D, labeling is done before drawing the specimen? Pre-analytical error. A mistake is about to be made before analyzation. How would a mistake be made before analyzation? From the options that are there, we need to prevent those mistakes. So in other words, 3 of those options are correct and 1 is incorrect. So which one would cause an error? Revealing the correct response, and hopefully 3, 2, and let's see if my screen's going to move. All right, give you all a feed. And we have a lot of correct responses. The correct response is D, but the system hasn't moved the screen yet. So if you label, your tube before you draw the specimen, that means that you may not have actually properly identified your patient. Your patient could refuse. You pick up this tube later that's already pre-labeled, and now you're using a tube on the wrong patient. So pre-labeling a tube is not something that you should ever do. And so there's finally the rationale. Pre-labeling tubes is a major pre-analytical error. Tubes should only be labeled after the draw and patient verification. And some of you all are doing so great, and I hope that that is improving your confidence because you know this. And I would show my face, but I'm afraid if I add my image again to the video that the system's going to go even slower. So thank you all for your patience. And I would hate to have to start this over again. So let's see if we can get through all 45 of our questions. All right. So team, what I may have to do, that's right, Miss Bonita, is I may have to use another computer and start this over again because the system is frozen. It is not moving. I know, and I tried so hard. I wanted to see you all, but this is not working well for me today. All right, question 13. While reviewing patients' charts, a phlebotomist notices that a previous lab result shows a critical low potassium level. What is the most appropriate action for the phlebotomist to take? A, call the physician immediately to report the finding. B, inform the patient and advise them to drink an electrolyte drink. C, document their interpretation of the lab value in the chart. Or D, notify the nurse or appropriate clinician. All right, what do? You notice a critically low potassium level. And then Salam, whenever you go to FloridaCareerAcademy.com, they're going to have the prices there. So I don't know the prices by heart for the hybrid phlebotomy course. And I'll also put that information in the chat. And it should be pinned to the very top. So if you go back to the top comment, you will see it there. Unfortunately, because the system's acting up, it is not allowing me to enter anything into the comment field right now. All right, so for question 13, we're torn between C's and D's. So let's see if we can get a few more responses. And thank you all for your patience with this system. If you chose D, you are correct. You're going to notify the nurse or the appropriate clinical supervisor. Phlebotomists are responsible for collecting and handling blood specimens accurately and safely. They are not authorized to interpret lab results or give medical advice. However, if a critical value is observed, they should follow institutional protocol, which typically involves notifying the nurse or clinical supervisor. This ensures appropriate licensed professionals actually can view and act on the lab value. So great job, team. A lot of you all chose D. And while we're waiting for the system to update, if you all have additional questions, I can, of course, answer them. Again, Amal says Chicago, $2,800. I'm not sure which one she's referring to. Maybe there's actually a course in Chicago. So Amal, if you can enter that information for, I think it was Salam, we'd appreciate that. But otherwise, if you all go to FloridaCareerAcademy.com and you scroll down to the bottom where it has the individual courses, you would see the information for our phlebotomy technician course. All right, question 14. During a routine venipuncture, the patient reports sudden tingling and numbness in their hands and fingers. What is the most likely cause of this symptom? A, the tourniquet is too loose. B, the needle may contacted a nerve. C, the patient is dehydrated. D, the blood is flowing too slowly into the tube. All right, let's see if you all can give us the correct response for question 14. All right, I'm starting to see some answers come through. All right, and so revealing the correct response. There it is there. It is B. You may have contacted a nerve. So tingling or numbness, known medically as paresthesia, may indicate that the needle has touched or is too close to a nerve, especially if the sensation is sudden or radiates down the arm or into the fingers. This is a complication of venipuncture that requires immediate action. The phlebotomist should stop the procedure, remove the needle, and inform the supervisor or nurse. Leaving the needle in place could cause additional damage to the nerve. And so that's why when you're performing venipuncture, you actually want to communicate with your patients, let them know if you have any, if it hurts, you're going to let me know. And so why am I saying that? Because not all of your patients are verbal. So if a person is verbal, they're probably going to say, ouch, you're going to move their arm. But if you are performing venipuncture on someone who's nonverbal, look for those nonverbal cues. Maybe they're grimacing. So don't be digging. When you dig, that is when you will more than likely hit a nerve and cause additional damage. All right, question 15 will be populating soon. All right, question 15. A blood specimen is rejected for lipemia. All right, so what is the most likely cause? And so that means you have to know your prefixes and your suffixes. Is it A, a patient exercised before the draw? B, the blood was hemolyzed? C, the patient did not fast? Or D, the blood was drawn too slowly? And so what does lipemia, what does it mean? What does it sound like? Think about those medical terms. So emia refers to the blood. What does the LIP refer to? And in 70, I don't have consistent schedules for phlebotomy. You all have been so patient and so gracious with us. I've been severely understaffed. We run a full training center in Jacksonville, Florida. And so I've not had time to come on and do a whole bunch of videos. So there's nothing assigned. It's just whenever I have opportunity to get online, I do so that I can be with you all. I know we're not supposed to use terms of endearment, but you all are my babies, the future healthcare workers of America and all over the world. And so I look forward to actually getting online. I just cannot give you a schedule right now. All right, so question 15, the answer is C. Lipemia refers to the presence of an abnormally high concentration of lipids or fats in the blood, which causes the plasma or serum to appear milky or cloudy after a blood sample is centrifuged. This condition is often caused by the patient not fasting before a blood test, or if a patient just has high cholesterol or triglyceride levels. And so if they eat a lot of fatty foods, you would also see like this milky substance whenever the lab is centrifuged. And so that means when it's spun. After you collect the actual lab via venipuncture, it has to be processed in the lab. And so there are multiple people who work together in order to ensure that the diagnostic test results that our patients have are accurate and correct. And so you all, since I am having such a hard time with this particular slide today, I am going to go ahead and end this live stream now. And I do apologize, but I promise I will get back on here probably first thing tomorrow morning and redo this all over again, starting from question 1. And I know you all are going to be saying, what time are you going to be on tomorrow morning? So I will say 8 a.m. and I will repost it. And again, I apologize. I'm not sure what's happening right now, but this is not conducive to learning because the system's going so slow. And I look forward to seeing you all tomorrow. So we're going to be ending now. I love you all. Bye.